I'm with Dr. Mark Parrish from Microsoft. Hello.
Hello.
What are you addressing this year at the World Healthcare Congress Middle East?
Well, what we're trying to do is to demonstrate how we feel that good software can help make a significant difference to business and clinical outcomes in healthcare. And we have some software called Amalga, which pulls lots of data together in the healthcare system. Health Vault, which gives you essentially your own personal health record as an individual. And then some software that allows you to easily log on and log off from different systems in the healthcare environment.
Okay. Can you tell us a little bit more about what attracts you to present here in the Middle East?
It's always nice coming to the Middle East. Thank you for inviting me here. But what I like about the Middle East is I feel that there is a great dynamism in the healthcare system in its wish to improve healthcare. And I mean, if you just look at some of the challenges of healthcare, cost, risk, quality, chronic disease, they're all represented here in the Middle East. Chronic disease is a particular challenge in the Middle East with very high rates of diabetes and cardiovascular disease. And the ability to come here and try to help solve some of those issues, particularly with the solutions that we have, we believe that we can actually help solve a lot of those issues, is very attractive to us.
Mm-hmm. How can information technology best improve clinical and business outcomes?
Information technology is something which can have a significant difference on business and clinical outcomes. And if we look at many other industries, they use information technology to support their overall strategy. And healthcare is starting to do that as well. So if you think of some examples in healthcare where maybe a patient is allergic to a particular drug, but this is not necessarily known by the next doctor they go and see, well, some good software can help you do that. If you think of patients with chronic long-term diseases, I was describing diabetes earlier, good software can make sure that those patients are able to manage their conditions well, and can also make sure that the relevant bits of information gets to their treating doctor or nurse, and they can then intervene as necessary. And all of the things that you and I are used to using every day in that consumerization of IT, with Facebook and our mobile telephones, various social networking, all of that is increasingly being used in the healthcare system to try to allow us to improve healthcare.
How is it being used?
Well, if we think about some ways, we have ways now for healthcare organizations to alert patients and to send them a text message, let's say, or an email, or even a telephone call when maybe their blood sugar is over a certain level, if I keep thinking of the diabetes example, of allowing patients to have an increasing ability to look at their condition and have an involvement in it and take some accountability for that care. And all of that, I think, will ultimately improve clinical and business outcomes in healthcare.
What types of challenges does Asia and the Middle East face in terms of healthcare information technology that other parts of the world don't?
Well, I think one of the things here in the Middle East and in Asia, which I also am responsible for, is just the huge population. And that population has not necessarily always had healthcare provided or been able to have healthcare at the same level that other parts of the world has. And yet at the same time, they have huge healthcare issues. And the issue, I think, of chronic disease, diabetes and heart disease, as I mentioned earlier, is the key one. And I think it's important, and what I like about coming to the Middle East is that governments here are focusing on that and wanting to do something about that.
Mm-hmm. And can you tell us what Microsoft is doing in terms of innovation in this field?
Yes, of course. Certainly I've described our Amalga solution, which gives you a single view of all of the data of somebody anywhere in the healthcare system. So whether you have data maybe with your general practitioner or maybe 2 or 3 different hospitals, a pharmacy, a blood testing laboratory, maybe an imaging center, it's often very hard to pull all of that information together. So we provide some software that allows you to see that in real time, and then you can slice and dice it, and that's very, very useful for whoever is looking after your care. At the same time, there are other things like you being able to have access to that information yourself, so you can start to do that.
Is this kind of software that the patient would have to bring with them, or it's the kind of software that the hospital has, all hospitals together, for example, provide together and the patient has access to it?
The patient has access to it. The patient has access to it online, so they don't have to bring it with them. You could have access to it.
Not like a chip or...
No, you could have access to it from your mobile telephone,
great.
From your PC.
So very portable, very practical.
Very
practical solutions.
Very practical. They have to be practical, because I think the important thing about IT, as with many other things, if they're not practical, people don't tend to use them. We use this because it's phenomenally practical, and we're doing more and more and more things with our mobile phone, for instance. The trick, I think, for us is to make sure that we provide solutions in healthcare that link directly to these practical things that we know people use all the time. So why can't I book an appointment with my GP from my telephone? Why can't I get my diabetes results on my telephone? Why can't I ask for a repeat prescription from my telephone? All of these things, I think, are increasingly will start to happen.
Why do you think an event such as this is very important?
It's important because it gets together people from different parts of the healthcare system and different parts of the world in the healthcare system. And I don't think there's anything which is more important than speaking to each other.